Good afternoon, everyone. In this poster presentation, we are discussing the outcomes with prostatic urethral lift in male urinary retention patients. We all know minimally invasive PUL is approved by NICE guidelines for treatment of male LUTS arising from BPE. NICE has released an updated PUL guidelines in 2021. In our trust, we developed a protocol to perform PUL completely under local anesthesia. In this study, we compared the outcomes between the patients presented with and without urinary retention. We assessed patients for 12 months from March 2019 to February 2020. The outcomes were compared for IPSS and QOL before and 3 months after prostatic urethral lift. Pain tolerability visual analog scores and quality of recovery visual analog scale scores were also compared. We recruited 39 men, including 8 of whom had urinary retention, 3 chronic retentions, and 5 acute urinary retention. Local anesthesia without sedation was used in 38 patients. One patient required general anesthesia in an early stage due to training issues, and one non-retention patient required sedation due to anxiety. All retention patients had successful TWAC in 3 to 5 days. Mean quality of life scores were similar for patients with and without retention. Improvements were similar in the follow-up. After surgery, IPSS score, quality of recovery visual analog scale, and pain tolerability were similar. As you can see in this table, there is not much statistical difference in both the groups with and without urinary retention. This study could be taken up as a real world experience for the PULSAR study, which was presented earlier. In conclusion, we propose prostatic urethral lift is equally suitable for patients with acute and chronic retention with comparable results. Thank you very much.